And just how serious is this uptick in COVID-19 cases? That big question and more with Professor Guido David of OCTA Research Group. Professor Guido, thank you for joining us and welcome to The Big Story.
Yes, hi. Good evening, Ed, and our viewers and listeners.
Yes, sir.
Story.
Yes, sir. You just mentioned in the soundbite that you're looking at the possibility of reaching 2,000 by year end. I just like to qualify that. Are we talking about a possibility or a probability?
It's a possibility, but I would say that there's a good likelihood of that happening, given the substantial increase in the positivity rate and the the number of cases over the past few days.
Yes, sir. Well, the numbers do seem to be very concerning. We assume that you also made projections down the line, not just for the year end. Have you also made projections for example, the first week or the middle of January and the end of January going down the line?
Well, so far we have projections until maybe the first week of January, until like about January 7 or 8, that it's possible to reach, I think, something in the neighborhood of 8,000 cases per day. Again, these are just projections. Our projections are based on certain assumptions. It's not yet clear if these assumptions will be met. So, I mean, this is just one possible scenario. The best case scenario is if the uptick will just, disappear. I mean, or the increase in cases will just disappear or plateau.
Yes, sir. I'd like to do a bit of a rewind. Did you say by January 7, you're looking at a possibility of what, 3,000 or was it a different number?
I actually said 8,000.
8,000?
8,000.
8,000,
Yes.
that's your worst?
Possibility.
Yes, sir. I suppose that's your worst case scenario.
It would be close to a worst case scenario, yes.
Yes, sir. Is this are these projections based on the premise that we are looking at an Omicron variant already spreading, or is this just simply based on the numbers that we have so far? I mean, exactly what are we basing this on?
It's a combination of both. We're looking at trends that we're seeing in other countries. And again, we're not claiming that there's an Omicron spread, but I'm just saying that we can't rule out that possibility at this time.
Yes, sir. Sir, just to also qualify, your projections are based on mathematical projections based on the numbers in the last few days and the last few weeks. Tama ba? So we're looking at a pattern, in other words.
Yes, definitely. It's a pattern. This is not based on a crystal ball reading, for sure. Yes.
Okay. Maraming salamat po, Professor Guido David of OCTA Research. Thank you for joining us tonight. We are not alone, though. COVID infections have been on the rise worldwide. Tonight's big number, 11%. That refers to the one-week increase in global COVID infections. That translates to around 5 million new cases from December 20 to 26. The World Health Organization says the overall risk due to the Omicron variant remains elevated. Research by South African scientists suggests that Omicron could possibly displace Delta as the dominant variant.